44% of adults in the United States take at least one prescription drug every day. And this is quickly becoming the norm in all modern societies. Should it really be that way? Do we all need a prescription drug? This video is going to list the top 10 most prescribed prescription pills for you, and it's going to go into some detail about what they're for and what you can do to maybe either decrease your dosage, should you be one of the people taking this prescription pill, or maybe even stop that pill altogether. I'm Dr. Ken Berry, a family physician with 20 years of experience in the clinic, and that's what this video is about. Doctors should never give a patient a prescription for a medication just to stroke their own ego so they'll think that they did something which is better than nothing, which is often not the case. And in the same light, patients should never mindlessly, thoughtlessly refill a prescription pill every month without considering each time they refill it, do I really need this every day? Should I continue to take this every day? Is there a way that I can either decrease my dosage of this daily pill or perhaps stop this daily pill altogether? Here's the list of the 10 most prescribed pills in the United States, but I think you'll find this data is reflected in most modern societies and what they're approved for and how you can either decrease your dose or get off them completely. Number one on this list is atorvastatin, also known as Lipitor. Now, this is FDA approved for high cholesterol, high triglycerides, and more concerningly, for the prevention of cardiovascular events, and FDA approved for the prevention of coronary vascular disease, of plaquing in the arteries. Now, as more and more research is being rediscovered, that statins, which this is a statin, they don't actually do that. They don't prevent heart attacks or strokes. They do lower your total cholesterol level and they do lower your LDL cholesterol level. But as a matter of fact, that doesn't actually protect you from heart attacks or strokes. There are other things that you can do that I'll talk about at the end of this video that you can implement into your diet and lifestyle to actually slash your risk of having a heart attack or a stroke. Now, we're all human beings. We all are born, we live, and we die. So don't think that this is a video about immortality. It's not. But I don't want you to thoughtlessly be taking a prescription statin for years or decades of your life and you're not receiving any meaningful benefit from that pill. While at the same time, you could be implementing dietary strategies into your life that would cut your risk of having a heart attack or a stroke by 20, 30, 50, 70%. And you're not doing those things because you don't know about them. The second most prescribed drug is levothyroxine, brand names Synthroid, Unithroid, or Levoxyl. This is an FDA-approved fake T4. It's not real T4. The only way they could get a patent on this is if they messed with the T4 molecule. So what you're getting in levothyroxine is fake T4. There are much better alternatives if you'll talk to your compounding pharmacist or a doctor who's more aware of the actual physiology that takes place inside your body and your thyroid. You'll quickly come to realize that taking a natural thyroid replacement hormone that contains real T3 and real T4 is a much better alternative for you. Now, for I think every single one of these medications, I've got a YouTube video on this channel about just that subject. And indeed, I've got several videos on this channel about low thyroid or hypothyroidism and the proper medications that you need to take for that and the proper tests that you need to be properly diagnosed for that. Number 3 on this list of most prescribed pills is lisinopril, also under the brand name Zestril or Prenavil. This is FDA approved for hypertension or high blood pressure and for congestive heart failure. This is a relatively safe medication if you truly need to take it every day. But many people have found with the dietary strategies that I talk about at the end of this video that they can either decrease their dosage of lisinopril or stop it altogether, because they can improve their blood pressure numbers by eating what I consider to be a proper human diet. More about that at the end of this video. Number 4 is gabapentin, which is sold under the brand name Neurontin. Now, this is FDA approved for partial seizure disorders. It's approved for post-herpetic neuralgia. So after you have shingles, sometimes you can have pain that lingers after that, and gabapentin does help with that. There's no doubt about that. It's also FDA approved for neuropathy. There's many different neuropathies, from diabetic neuropathy to idiopathic neuropathy. Idiopathic meaning we don't know what the hell causes it. And then it's also FDA approved for fibromyalgia. Now, if you take gabapentin for one of these, you have to understand that a very high-fat ketogenic diet or a high-fat carnivore diet can completely put your seizures into remission, can completely make your post-herpetic neuralgia go away, can greatly improve your neuropathy or your fibromyalgia symptoms. Number 5 on this list is amlodipine, sold under the brand names of Norvasc or Amvaz. This is FDA approved for high blood pressure and also for congestive heart failure. Again, high blood pressure or hypertension is one of the 5 markers for metabolic syndrome, and you can greatly improve, if not completely reverse, your metabolic syndrome by eating on the spectrum of the proper human diet that I talk about at the end. Number 6 on this list is albuterol, sold under the brand names ProAir or Proventil. This is FDA approved only for bronchospasm. And so many people with asthma or with COPD or chronic bronchitis are prescribed albuterol. And usually this is a proper prescription. But what people with asthma, with bronchospasm, with COPD don't realize is that the bulk of their bronchospasm is caused by 2 things. Number 1, chronic inappropriate inflammation that manifests itself in the alveoli of the lungs, and also chronic confusion of their immune system. And when they start to eliminate foods from their diet, like all sugars, all grains, and industrial vegetable oils, their chronic inflammation and their immune system confusion starts to get better, almost as if by magic. It's not really magic. You've just been causing your inflammation and your chronic immune system confusion by eating inappropriate foods. Number 7 on the list of most prescribed pills is hydrocodone, usually combined with acetaminophen or ibuprofen. It's sold under the brand names of Vicodin, Lortab, Norco. Chronic pain is epidemic in most modern cultures, and indeed the majority of adults suffer from some kind of chronic pain, whether mild, moderate, or severe. What many people don't understand is that their chronic pain is not caused by that old injury. That old injury is just the seed of their chronic pain. Their chronic pain is actually coming from the chronic inappropriate inflammation caused by their improper diet and improper lifestyle choices. It's not your fault, but it is your problem. And so if you're having to take a narcotic pain reliever like hydrocodone, I would greatly encourage you to look into my diet videos on this channel to help you understand how to decrease the chronic inappropriate inflammation in your body. Number 8 is omeprazole. This is sold under the brand name of Prilosec. This is for FDA approved for GERD, chronic reflux that is pretty severe, for the treatment of gastric ulcers or the prevention of gastric ulcers, and for the treatment of duodenal ulcers. So this is one of those medications that people start taking, and in many cases, the standard of care is to only take it for 6 or 8 weeks, but you keep refilling it at the pharmacy because you're not a doctor. You don't know better, and your doctor keeps renewing the prescription for you because they don't realize the harm that can be done by this acid blocker and by any of the acid blockers. I've got videos about that on this YouTube channel if you want to check those out. It's very common once you start to eat on the spectrum of the proper human diet to no longer need any acid blocker whatsoever, and especially omeprazole. Number 9 on this list is amoxicillin, which is an antibiotic, and it's sold under the brand name of Amoxil. It's FDA approved for bacterial infections, and that word is key. We'll get back to that. For strep pharyngitis caused by the strep bacteria, for bacterial sinusitis, and for bacterial otitis media, which is a middle ear infection. So the first thing you have to understand is that amoxicillin is an antibiotic. It works against bacteria, not all the bacteria, but just a certain set of them. Amoxicillin does not help viral infections at all. It is a complete waste of your copay, waste of your time, and waste of a trip to the pharmacy if what you have is a viral infection. It's also FDA approved for community-acquired pneumonia that's caused by a bacteria. Now, here's where doctors and patients get into trouble, because amoxicillin is a quite powerful antibiotic. It can cause havoc on your gut microbiome, the bacteria that should live in your gut and help you with many, many functions. So what if you have bronchitis, but it's a virus? How does your doctor know it's a bacteria? Well, there are a few clinical hidden clues for the doctor, but there's no way, unless they check a sputum culture or a bronchial culture and send it off to the lab, there's no way they can know whether it's bacterial or viral. And so here's the thing. At least 70% of infections that cause you to feel tight in your chest, to cough, to have a low-grade fever are viral. The majority are viral. The majority of causes of strep throat, or not strep throat, of just a sore throat, are viral in nature. The majority of causes of a middle ear infection are viral in nature. So when your doctor's writing you a prescription for amoxicillin or any antibiotic because you have symptoms of bronchitis, sinusitis, or an ear infection, that's probably an inappropriate use for that, because over half of those infections are caused by a virus, which laugh at antibiotics. I actually have a chapter in my book called Lies My Doctor Told Me that deals with nothing but this antibiotic issue. So if you truly have a bacterial infection by a bacteria that's responsive to amoxicillin, then it's a brilliant drug to prescribe and to take. But if you have a virus or another bacteria that's not affected by amoxicillin, not only are you destroying your gut bacteria temporarily by taking this strong antibiotic, you're not helping the infection at all. And then number 10 on this list of most prescribed pills is losartan, which is sold under the brand name Cozar. This is FDA approved for hypertension, for diabetic nephropathy. And the thinking on that is if we keep your blood pressure lower, then that should protect your kidneys. Also for heart attack prevention, stroke prevention, and congestive heart failure. Again, most of these things are caused by having out of control metabolic syndrome. And I've got videos about metabolic syndrome on this channel if you don't know what that is, or if you've been diagnosed with that and you still don't know what it is. If you'd like to know how to reverse your metabolic syndrome, my videos will help you with that. So as you move from eating a standard American or a standard modern diet to eating more on the spectrum of a proper human diet, your metabolic syndrome is going to improve. Therefore, your blood pressure is going to come back down closer to normal. Now, you may not be able to stop the 2 blood pressure pills I talk about in this video completely by eating the proper human diet, but you should at least be able to decrease the dosage. And that's a vital key for all 10 of these drugs. If you don't need them, then you should not take them. But if you do need them, it's fine to take them, but you want to always take them in the lowest milligram dosage possible. And in the case of levothyroxine for the thyroid, that's a microgram dose, but you want to be taking real T3 and real T4, not fake T4. There are 2 very popular diets right now, and a lot of people consider them to be new fad diets, but they're actually the oldest diets known to humanity. They are very low carbohydrate diets because that's how human beings are designed to run. The keto diet you may have heard of, the carnivore diet you may have heard of. Both of these are very, very low carbohydrate diets full of fatty meat and all of the other foods that you need to get all of your amino acids, your fatty acids, your vitamins, and your minerals. At the end of this video, I'm going to have a playlist pop up here and here so that you can pick either Keto 101 or Carnivore 101. Start learning about this version of the proper human diet. Start reversing your metabolic syndrome, your blood pressure, your diabetes, your fatty liver, your reflux, your chronic pain, your chronic neuropathy. These diets will help you with that. They may not cure it, but they're gonna make it better because you are removing toxic inflammatory things from your diet, which human beings should not be eating to start with. Now, you can tell from the content of this video and all the other videos on this YouTube channel that I'm never going to receive a check or a sponsorship from big food corporations or big pharma corporations, but I can benefit from some help from you. I have a link down in my show notes to my Patreon page. It's a very quick sign up, and you can throw a buck or two my way so that I have more time and more resources to make videos just like this while I hold my breath, waiting on that big check from big pharma or big food, which is not going to happen. This is Dr. Barry. I'll see you next time.